My name is Shay. I'm an orthopedic surgeon here at the Reno Orthopedic Center, specializing in hip and knee replacement surgery. I got my undergraduate training at Harvard University in Cambridge, Massachusetts, and then traveled down the coast a little bit to New York, where I did my medical school at Columbia University. And then came back out west for residency in orthopedic surgery and spent 5 years at Stanford. And then got one final year of subspecialty training in hip and knee replacement back in New York at the Hospital for Special Surgery. I'm relatively new to Reno Orthopedic Center. I joined the practice in September of last year, and I was originally attracted to Reno and to the ROC in particular because of the awesome group of surgeons and staff here that really pride themselves on providing the highest quality orthopedic care to patients. And even though it's only been a short period of time since I joined, I can say that initial impression has definitely held true, and I'm really grateful for the wonderful group of people I get to come to work with every day. Reno has also felt like home to me, even though I've spent most of the last 2 decades on the coast in big cities. I'm from a small town in northern Utah, and so having a little more space here and access to the outdoors has been a nice change of pace for me. I specialize in joint replacement surgery, which is done for conditions affecting the hip and the knee that ultimately lead to breakdown of the joint. The ultimate treatment for patients depends on the severity of the condition, the needs of the patient, as well as the impact that the pain is having on the patient's quality of life. So a patient who needs to get from their house to the corner every day is going to have different needs than the patient who's an avid skier, for example, and I tailor treatments based on those needs. Oftentimes we're able to keep patients at their desired level of activity with non-operative treatments, but when the quality of life is impacted due to the pain to a degree that's not adequately relieved by those non-operative measures, that's when we decide to move forward with a joint replacement surgery. My approach to joint replacement involves both less invasive surgical techniques as well as integrating robotic technologies. So for hip replacements, I predominantly do an anterior approach, which has been associated with quicker early postoperative recovery. And for knee replacement, if the arthritis is localized to one aspect of the knee, then I'll do a partial knee replacement, which has also been associated with a faster early recovery. And for both hip and knee replacements, I use robotic technologies, which allows me more precision with the implant placement and the ability to customize that placement based on the particular anatomy of the patient. Joint replacements have changed a lot over the past 5 to 10 years. A lot of people come in with the expectation that they'll be admitted to the hospital and have to stay for several days before going home. But because of improvements to both surgical technique and perioperative treatment, anesthesia, and pain control, we're able to get you into our surgery center or the hospital and have you up and walking right after surgery with a physical therapist and go home the same day. Thanks for spending the time to learn a little bit more about what we do here at the ROC today. I look forward to seeing you in clinic and helping you get back to living your active, healthy life.